Asthma can have a very big impact on a sufferer's life, as we know, and if left untreated, it can be very dangerous.
Now, there's a new report out this morning that says it can lead to mental health issues, but the difference can be as simple as taking your medication, and that's according to 23-year-old asthma sufferer Alana Woods, who is studying musical theatre in Melbourne.
My parents were always playing music when I was a kid, and I always listened to it, and I remember probably my first introduction to it was listening to Phantom of the Opera. I just love the feeling I get when I am able to sing, and the joy it brings to other people. I was born with asthma. It was pretty severe. I've been hospitalised a couple of times. I was hospitalised quite severely when I was six, I think. There was a period of time where I didn't want to take my medication because the steroids and the medication affected my voice, and doctors would say to me, well, do you want to sing or do you want to breathe? And I'm like, I want to sing. A lot of mental issues of like, I don't think I could be able to do this. How am I supposed to be able to sing if I can't breathe? And a lot of battles with myself, wake up in the morning and go, you need to take your medication. I can't have a singing lesson today. My teacher, Linda, was amazing in getting me to realise that it's important that I work with it, and that I get the right medication and get the right asthma action plan to actually work with my singing.
Well, with us from Sydney is Asthma Australia CEO Mark Brook. Mark, thanks very much for joining us this morning. Let's go back a little in terms of this discussion. What are the mental health issues that you've discovered that can arise if young asthma sufferers don't take their medication?
Well, good morning, Beverly. I think the survey that we're releasing today, the National Young People and Asthma Survey, clearly indicates that there's a correlation between how young people perceive their asthma, whether it's controlled or not, and what their emotional well-being might look like. So the survey uncovered a whole range of factors, including the perceptions of one's identity, whether or not they had a support group and a group of friends to care about them, and some shaming and embarrassment about admitting that you had asthma.
So the mental health issues as such are not, we're not talking about depression or more serious mental health issues.
Certainly, we found that young people that have severe asthma reported to us that they did experience anxiety and depression, but that's a group within the asthma community that has the most severe of the condition.
And when you say at higher risk, what are we talking about in terms of numbers?
We're certainly looking at about 15% of young people, so 2.3 million Australians have asthma. About 1 in 10 young people aged 12 to 25 will have asthma, and about 10% of those will be experiencing severe asthma and may experience some emotional and social issues.
So what are the messages from your organisation in terms of, I guess, firstly managing asthma to start off with, and then sort of being alert to these issues?
Look, I think, as Alana's story quite clearly shows, asthma doesn't need to hold you back. And we would encourage young people to make sure that they have open and honest conversations with their parents, with their friends and their mates about what it's like to have asthma, to surround themselves with a community of care. But more importantly, they need to maintain a regime of taking their preventer medication. Asthma is a condition that comes and goes for a lot of people, so they may take their medication, drop off, and all of a sudden they'll have a flare-up and their asthma will put them back in hospital or make them take time off work or school. So really it's about being open and honest with yourself and your family and your circle of friends and saying, look, I have asthma. It doesn't limit the majority of my social participation, but in some cases I may not be able to do the things that we'd like to do all of the time.
I wondered too whether there needs to be a conversation perhaps in the schools where you try and break down that stigma, perhaps not only asthma but just generally talk about some of the issues that young people face and some of the obstacles.
Yeah, absolutely, Beverly. I mean, right now we're going back to school, and we'll see an enormous spike of asthma-related hospitalisations in children and young people as the flu and every other allergic condition happens in the next couple of weeks. So what we would encourage, particularly teenagers, to do is to take a step back from being judgmental about someone's overall health and well-being. Have a look at the way in which they're treating their mates and their friends. And if someone is out of breath, it's not because they're slow or they might not be able to do the condition. It may be because they have asthma.
In terms of the medication, I'd imagine if you were 10 or 11 years old and you weren't getting too many attacks, it would be a hard thing to get that sort of mental thinking around, well, I need to keep taking something for something that doesn't appear to be happening anymore. How imperative is it to constantly take medication, or are there medical reviews that happen along the way?
Look, we'd encourage parents of children, young people and young adults to make sure that they're seeing their general practitioner at least twice a year for a regular review, to make sure that they have an asthma action plan. You know, Australia has a proud record in international standings in looking after people with asthma, but only 23% of all people with asthma have an asthma action plan, which isn't a pass mark in our view. We need to make sure that everyone has an asthma action plan, and they follow a daily routine. They take their preventive medication and they carry their reliever medication for when they feel it's appropriate to get a top-up.
Mark, thanks so much for joining us.
No worries. Thank you, Beverly.